I don't know if a dead mic's a telltale sign I shouldn't say anything or not.
Dr. Cohen, do you have anything to do with that?
She could have. Dr. Cohen, thank you for being here. And again, thank you for coming by my office and introducing yourself and trying to give us some sort of background. Committee, I do think she knows the acronyms in healthcare, which is a big plus for a new secretary coming in. I believe you're our 5th secretary, right, Ralph, in our tenure here. And certainly your background makes you very qualified to be able to take over this. Just a couple of questions. First of all, I'm glad to see that you got your medical training and your public education degree, your master's degree from 2 fine divinity schools.
Thank you, sir.
At least that's what I understand they were started. You talked about teamwork. You talked about being in the position of CFO, et cetera. Were you also in charge of that team that rolled out the first website for the Affordable Care Act? Were you in charge of that?
So was not part of the first iteration of the rollout of that website. At the time I was working on Medicare payment policy, but it was quite a career-defining moment for me, and certainly career defining for the agency as well. It was a big public failure. There's no way around it. We've had multiple case studies written about it, and it honestly was, in the space of crisis, I think there's I try to find all of the things that you can learn from it, and what I learned about any big technology failure, it's not about technology. It's about people, it's about accountability, it's about communication, it's about transparency. And those are really some of the lessons that I learned, and I know you and I have had good discussion about how I can bring some of those lessons here to the department. I've brought one of the operations people who worked with me at the department whose area of focus is this, because I know how important executing well on IT projects are to the success of our overall mission. And so you will see a lot of focused attention on those from me.
Okay, thank you. Can I ask a series of questions, Mr. Chair, and get quickly through this?
Yes, let's be mindful of the time if we
Yes,
can.
sir. Just a question. We heard a very disingenuous statement from the president when he said that you could keep your health care and your coverage and keep your doctor, and that has failed spectacularly. What do you think is the reason for that?
Not to quote our current president, but healthcare is complicated. And I think that it is hard when you're making changes in the healthcare system. I think this committee knows better than most, when you make one change, there is an unintended consequence somewhere else. And I think it's a matter of playing through those consequences of changes and making sure that we are understanding them and prioritizing. I think that was one, while I didn't work for the president at that point, I think that was one of the times where there wasn't an understanding of some unintended consequences of decisions, and I think you saw the administration try to react to that and mitigate those. But this is where, again, in healthcare, you change something over here on the left-hand side, and you don't even realize all the way downstream, somewhere you weren't thinking, there's an impact. And I think that's why an open dialogue with this committee is really important, because things will come up. I know in my time here that we'll need to have an open dialogue about and think through how do we mitigate issues that are happening.
Thank you. I will say to the committee that she's very pragmatic and recognized when she met with me that I was very impatient when it comes to the LME MCOs, mental health, drug addiction, and child welfare. We had a federal report that was the Children and Family Services Review, and we failed that miserably. Part of it was because of IT and processes. Have you had an opportunity to look at that and see where we can go as far as child welfare?
So certainly a lot of room for improvement, and I appreciate your leadership in this area and also sharing with me the areas of focus, because even within that audit there is prioritization that's needed. But certainly I want to make sure that we are focused on those that are most vulnerable, the kids that depend on our services. It can't be an IT system's supposed to, propel us forward in terms of our ability to do work, in terms of, right now, because we have county-based systems, someone goes across the county line and we're not able to share that information. So I know how critical it is for those IT systems to come online in order to support the work.
One follow-up, sir, and I'm done.
Yes.
I know the facilities managers here. We spent about $405,000 in the last number per bed at Broughton, and about $386,000 per mental health beds, which are desperately needed at Cherry. Now Broughton's delayed. Are the beds at Cherry operational now? And are they online? Where are we with these mental health beds?
A great question. I've been to both Cherry and to Broughton, and different issues with both. And you and I have spoken. The delays at Broughton are just unacceptable. And within my first couple of days being in the role, I was on the phone with the contractors and their CEOs back in Chicago, and we've had a number of in-person meetings at the site, walking the construction site together to say that's just, was an unacceptable place, and we've taken some legal action as well on that side. But in terms of Cherry Hospital, also a project that was a long time coming. What we're seeing now are, so I was just there and touring, and Senator Pate knows this. The one thing that they pointed out most in terms of construction that was an issue for them were the doors. So they're having to do a lot of revisions of the doors because they weren't as safe as they needed to be. So there's a lot of work going on to do that. But I think the more important issue is really about the staff. And so we've expanded the capacity of Cherry Hospital, but at the same time, they are having a very challenging time recruiting the doctors, the nurses, and other staff they need to actually be able to open up additional units. Cherry Hospital hasn't been able to hire in almost 2 years, which is very concerning to me, which also, there are also, of the I think there's 15 psychiatrists, 5 of them are eligible for retirement, which also makes me very nervous. And so I want to make, part of having a facility that is worthy of the folks who need our care, we also need great doctors and great nurses to be in that facility.
Is that the reason, and this is the last one I promise, is that the reason that the prior department raised the psychiatrist's pay, and they're now, when you come in, you have raised their pay 9 to 19%, and some of them are making $300K, which I have no idea what a psychiatrist makes. To $300K is, that's about retaining docs? Is that what we're talking about?
Yes. So I think overall, I would say that you should know on the salary issue that I've asked my team for sort of a comprehensive review of what's going on, not just at Cherry, but across, to make sure we're understanding and making good decisions and being transparent about those decisions from a process perspective. But the bottom line comes down to, do we have the staff needed to be able to bring online the additional units and the beds that are badly needed? And right now at Cherry, we don't. That means we're needing to rely on locum tenens and other types of transitional help, which are expensive and not longitudinal, meaning not the best care for our folks. So, I want to make sure that we have all the tools in our toolkit to be able to serve the community through Cherry Hospital. Obviously, I'd look forward to your feedback and input as we work through that.
Members of the committee, we are fast approaching our deadline, but we need to plow on through this and try to bring this to fruition if we possibly can. So I would ask for your indulgence as we go through questions, make them short and sweet answers if we could. Senator Tart.
Thank you, Mr. Chair. A couple quick ones if I can. The first one, Dr. Cohen, it's a pleasure to have you here. Your credentials are obviously impeccable. But it's interesting, your board certification, that typically I think in internal medicine is 7 years. Do you plan to really let that expire?
It's 10 years, comes up in 2018. And I've been thinking a lot about that. I don't practice clinically right now, but it's important to, obviously, I train to care very much about patients. I've actually talked to folks about seeing if I could carve out some time to do clinical practice again. So I think it's on top of mind for me because 2018 is around the corner. And so I'll let you know.
All right, follow up?
Yes, one follow-up, and let's limit our questions after this to one question per member.
All right, then we'll go this, and it's kind of a two-parter then. I'm going to fudge here a little bit.
One question, Senator Tardy, if you please.
Okay. Can you speak to your affinity or applicability you think we have for a single-payer system and/or going to a case-rate state like Maryland?
You know, so I'm very much focused on the opportunity here in North Carolina. I've in terms of the movement to managed care, I think that we are the largest state that has not yet moved to managed care, and there are a number of states who have seen a lot of success with that. I've also seen states that have struggled. In fact, Illinois a couple weeks ago said this managed care isn't working for us and we need version 2.0. And so I want to make sure, as I think about our evolution in Medicaid, that we are bringing the learnings of those other states here to North Carolina, and we're building a strong Medicaid program based on where other folks may have learned some lessons that we can benefit from. Thank you.
Senator Woodard, and if other members have questions, please let it be known to me.
Thank you, Mr. Chairman. Secretary Cohen, thank you. I join my colleagues in thanking you for the time you spent with us and having some preliminary conversation about this. As you know, during our conversation last week, use of data in healthcare, since that's my job, is very, very important. Senator Tucker and I share that concern, Senator Tart and others. I want to talk about data security because it's such a major problem. And of course, HHS has had a series of issues in information technology, data security being one. Now, could you talk about your experience working with data security of information and how you see the department moving forward to secure the data the agency maintains?
I appreciate the question, and it is something from wearing my hat of Chief Operating Officer at CMS that was very much top of mind and spent a lot of time on. We made sure that data security wasn't just the job of those whose title it was for security, though we wanted the best on that too. As you know, Medicare has a lot of sensitive data that within it. And so in addition to making sure that we had the most effective tools for cybersecurity, what we were finding at CMS is that we were actually being attacked through phishing, which is through email attacks, and then you click on a link, and that's how folks would get access to our system. And so we had a campaign that was across the entire agency where we had a contest, and we would put exercises out there and for people to see if they would click on it, and then we would report back. Because I think the only way that you can be vigilant about security is to constantly be testing, whether it's penetration testing on the cybersecurity side, or doing these kinds of exercises where we recognize that it is everyone's responsibility to be focused on security. I think those are the things that I will bring here to North Carolina in my new role. I think the team, we've reviewed some of the security issues at the department. I think they're doing an excellent job, but always more to do.
Senator Ballard.
And if the chair would indulge me, I actually have two questions, but I'll be brief. The first question that I would like to ask is, I've reviewed your SEI disclosure statement as well, and it does come back stating that they've found the potential for a conflict of interest. So I was just curious if you could actually comment on how you're prepared to handle, take appropriate caution in that as you take on your responsibilities.
Yes, I very much appreciate the Ethics Commission going through their process and identifying that we don't have any conflicts. But you met my husband earlier. He's a lawyer. We still love him, but he's a lawyer and works in healthcare. He currently has no clients here in North Carolina, but wanted to make sure that we stay vigilant on that. And if that were to change, that we would report that to the Ethics Commission and take any necessary steps that they would recommend at that point, whether recusal or otherwise.
Thank you for that. Also, my second question, sharing similar age and yet vast and rich work experience, I understand also the scruples that are involved with kind of that wide network of individuals that we work with, professional relationships, and even the level of management that's involved with, a lot of the jobs that we've had to hold, essentially. But you speak a lot and you use a lot of great buzzwords of transparency and accountability, but I also know that there have been reports, of assertions of kind of a trust but don't verify attitude regarding fraud. I think also there was kind of some internal audit reports with the VA, your time at the VA, and those with the women's health issues regarding that. So I didn't know if you could elaborate maybe a little bit on two of those concerns, and what you learned from that, having kind of managed a lot of different individuals and teams, and then processes and organizations too.
Sure. At the federal level, whether it was the Office of the Inspector General, the General Accountability Office, I work closely with those who would come in and study our programs. I think they make us stronger. They can see things that sometimes we can't see and are asking important questions. And so we've always had good collaborative working relationship. The state auditor here and I bet have a good relationship in terms of exchanging ideas, and her sharing with me what she has learned about the department. And I've appreciated our team being very responsive to the concerns of the auditors and making sure that we are jumping on issues that are there and making sure that we're addressing them.
Senator Davis.
Thanks, Mr. Chair. Madam Secretary, I want to first commend you, especially out of all of your portfolio, your service with our veterans. That's near and dear to me, and I just want to thank you first and foremost there.
Thank you.
I represent rural communities. I'm very concerned about Eastern North Carolina, and obviously beyond when we talk about our rural communities. How do you see working with local healthcare providers to address specific needs of care in our rural communities?
Well, I've really appreciated over the last 8 weeks being able to travel around the state and travel to a number of communities where they've shared some of the issues of access to care in rural areas. And I will say also at the federal level, my boss was from Hinton, West Virginia, and was very what made sure that we had a focus on rural health and all we did. Part of what I did in my last job was establish a rural health council within CMS that had a focus on, as we're making policy, making sure that we are thinking about how that delivery would play out in rural areas, because it is different. When I think about access to care in rural areas, I think that this is where technology is going to be very critical for access to care in rural areas. I was talking to someone earlier about where I think telehealth can play a really important role. And as I think about the opioid crisis in particular and lack of access to treatment, I want to use as many creative ideas that we can to think about how do we bring psychiatrists and other types of treatment to rural areas. As I mentioned earlier, it is very challenging to recruit good providers to rural areas. So I think that's where technology can potentially bridge some of those gaps. It is something that folks are struggling with across the country. And again, what I push our team to do is look for places in the country where is it working well, and how do we bring those best practices here to North Carolina.
Senator Lowe, you had a final question.
Yes, thank you so much. Secretary Cohen, we certainly appreciate you and all of the work that you have been doing. The question I have is, I represent an urban area, and many of us have to deal with elderly parents more and more and more. and the paperwork and other kinds of things that you have to go through just trying to get to the bottom of what can be done. How can we help them? Where do you have any vision for that?
Yes, so as someone who just worked in Medicare, I think I know some of those issues, and as someone, our folks at the department are always available to you in terms of talking through, are there ways in which we can help folks navigate a complex system in a better way? And are there ways, and there is a lot of paperwork that's out there, and are there ways to both streamline those and as well as make them as understandable as possible to folks who, they're confusing to those of us who even work in healthcare. And so how do we make them as understandable to those whose everyday lives are not part of healthcare? But it's also making sure we maintain a focus on getting folks the access to care that they need, the services that will keep them healthy and productive and safe in their lives. Thank you.
Senator Robinson, I'm sorry, I apologize to you. I'm not used to you being to the right of me, so I failed to see you. But please go ahead with your question. This will be the final question.
Thank you, Mr. Chair, and we'll tell the Sergeant at Arms to put me back where I belong then. Thank you so much. Secretary Cohen, I really appreciate your having visited with us, and I appreciate the vast experiences that you have brought to North Carolina that can certainly help us address a lot of the issues we face, especially in communities, and I've served in community-based health for 45 years. But you mentioned the opioid issue, and you were in High Point, my district, yesterday. I thank you and appreciate that. One of the issues that I'd like for you to quickly address is, what do you see, and we're not talking, Senator Page and Tucker and I introduced the bill on Noxalon, and that's on the end of saving lives, but prevention is on the earlier end of service. What do you see as one specific kind of strategy to address not only opioid, but the whole substance abuse issues in our communities?
Yes. It's a complex issue that needs a coordinated response, and so what we are trying to do at the department is focus on how does everyone from public health and mental health and Medicaid and social services, and use all of the strengths across the department to be more coordinated to tackle the crisis. A very big one is access to treatment, and so we were hearing multiple times yesterday in the roundtable discussion we were having about the challenges of access to treatment, and the fact that opioid addiction in particular and the recovery from that is really quite an extensive and long process. It's not 30 days and done. And so how do we think about that ongoing care for folks beyond their initial treatment in that very first period of time, but that ongoing recovery process, which is long, and to show folks that they can return to work and can return to school. We heard some very powerful stories yesterday at High Point where they were sharing their personal stories about their recovery, how challenging it was, but how the services, when they were available, were really the critical piece for them in being able to stay in recovery. And so we're focused on that. We also spend a lot of time talking about prevention. How do we get into schools and talk about this issue with our teens? And folks are even talking about making sure it's not high school but even in earlier, and have that open conversation. And so I think there's a lot of great work that we're going to do together on this topic, and our department is rolling up our sleeves to do whatever we can to support it.
Dr. Cohen, thank you very much for your responding to the questions that have been proffered to you, and we certainly will take all of this into our considerations. That ends the questions from members of the committee. It is time to consider whether or not we have a vote, a recommendation to make to the Committee on Nominations. Chair recognizes Senator Prowick.
Thank you, Mr. Chairman. And quick comment. Dr. Cohen, I was remiss in not thanking you earlier for your assistance on an issue that Senator Harrington and Tucker and I have been working on to track our children in the system. And with your help and Dave Richard, we were able to get that issue resolved, and I thank you very much for that. With that said, Mr. Chairman, I move that the Committee on Health Care recommend to the Committee on Nominations that Dr. Cohen be confirmed as Secretary of the Department of Health and Human Services.
So the question before the committee is whether to recommend to the Committee on Nominations that Dr. Mandy Cohen be confirmed to the office of Secretary of the Department of Health and Human Services. All in favor will please say aye. Aye. All opposed will say no. There were no noes heard, and so the vote is unanimous, and this will be reported to the Committee on Nominations. Dr. Cohen, thank you very much for your attendance here today. Thank you, audience, and
Thank
my
you.
apologies to the House.